Hello and welcome to Chairside Live. I'm your host, Megan Strong. Thanks for tuning in today. In this episode, registered dental assistant Will Schmidt is back with another edition of Across the Chair. He's discussing the temporary cements he uses for provisionals. Let's hand it over to Will and see what sticks.
Well, thank you, Megan. Quite often on Chairside Live, I present detailed tips and techniques on BioTemp fabrication and placement. I recently received a viewer question regarding temporary cements and my preferred choices during the BioTemp placement stage. I don't believe that any case is typical, and there's no single universal cement that is advised for all cases. Today, let's revisit some previously featured treatments where I assist Glidewell's own Dr. Anna Maria Murashan and take a closer look at the methods behind secure provisional placement leading to effective permanent restoration bond strength.
Starting off with a pretty straightforward, low-risk treatment, this patient from Chairside Live's episode 178 needed replacement of 3 old, failing anterior crowns. Upon removal of the existing crowns, the preparations were found to be comprised largely of natural tooth structure. From a provisional standpoint, this gives me more room to choose from a wider array of interim cements due to the negligible chance that cement would adhere to the preparations or cause a bonded core buildup to fail. I've also taken into consideration the darker stump shade that could very well cause the temporaries to have a lower value or a gray appearance. With these factors in mind, my go-to cement is TempoSim NE by DMG America. NE, of course, is an acronym indicating that this cement is non-eugenol based. However, this product is also sold in a eugenol containing version. This patient has experienced a 0% sensitivity level throughout treatment, so I feel confident that a non-eugenol based cement is sufficient to continue this trend until the final seat date. The opaque appearance of this cement helps to mask the dark underlying stump shade and relieve any worry that too much of a gray tone might be present. Moving on to today's second example, this patient required the preparation of teeth 13 and 15 before the same day extraction of number 14 and an immediate BioTemps bridge placement. Factors to consider in this multifaceted appointment include keeping cement clear of the fresh extraction site and the amount of time the patient will wear the BioTemp while healing before final impression and a second time frame under provisional before a restoration can be permanently secured. I aid in the prevention of scattered temporary cement by placing a layer of Teflon tape under the BioTemp and removing it in a manner that will wick it away from the site. I have chosen to use TempoSim in this instance, but this time in the eugenol infused formulation. The inclusion of eugenol in dental products is meant as an antiseptic and anti-inflammatory sedative. However, clinical studies have shown that permanent restoration bond strength is reduced in some instances by the use of eugenol-based temporary cements, especially when seeding final restorations with resin-luting cements. Dr. Gordon Christensen addresses this topic in a very practical approach. He suggests that the time between the use of eugenol-containing cement and seeding of the final restoration is the key factor. If seeding the restoration with resin cement a day or two after seeding the BioTemps with eugenol-containing cement, the final seat would be affected by the free eugenol in the provisional cement. In this instance, the fixed prostheses are being seeded weeks after extraction site healing, final impression, and a second provisional stage. Therefore, the free eugenol has been dissipated by chemical integration with the zinc oxide, and the final cement is not affected by the mature eugenol-containing provisional cement. I can comfortably seat this BioTemps bridge with TempoSim or even TempBond and ensure that the prepared teeth can get the soothing eugenol benefit without suffering long-term bond strength consequences. A typically tricky temporary situation deals with the adherence of a single unit anterior. Single units are more fragile, easier to floss off, and have the least retentive qualities throughout. Additionally, when dealing with a single anterior provisional, shade matching is also a priority. In most cases, when seeding a single unit crown or veneer BioTemp, my trusted cement is TempBond Clear. Now, TempBond Clear is a resin cement, so care must be focused on areas where a composite buildup may be present. In these cases, it is a good idea to swipe a thin layer of Vaseline over the composite to prevent the resin cement from pulling it out when you remove the temporary. The best benefit to the use of TempBond Clear is its high retention value. A recently published traction and thermocycling test of provisional cements showed that out of the top 5 most popular cements available, all cements showed reduced retention values after thermocycling, and this is the simulation of heat fluctuations within the mouth during wear. With the single exception, of course, of Temp Bond Clear, where the retention value remained constant throughout. The cured cement peels off cleanly and removes easily on the final seat date, causing no interference to the seating of the obsidian monolithic crown and the ceramide-eluting cement. The most common question I'm asked in regards to seating provisionals deals with combination cases. Since the BioTemp units are most likely splinted into one continuous unit, a combination of veneer, crown, bridge, or even inlay or onlay can be included. In combination cases that only involve crown and bridge units, the application of Temp Bond, TempoSem, or similar cements can be used. In any instance where a veneer unit is attached to the temporary or aesthetics are a factor to consider, Temp Bond Clear should be used for all units. Absolutely try to avoid using multiple cement types under a splinted provisional as to maintain the predictability of the seating, cleaning, and finalization process. Due to the less retentive properties of a veneer BioTemp and the increased retentive properties studies have shown on Temp Bond Clear, it is the safest decision I feel I can make when seating these units. All too often, when difficulties arise in the temporization of veneers, an easy fix is to bond the temporaries with a dual cure method such as a spot of bonding agent or flowable composite. I try to avoid this method entirely unless it is the last effort and all other attempts are unsuccessful. The temporaries are usually destroyed upon removal and cannot be replaced if needed. The cleaning and preparation before final seat has also been compromised. It is important to keep in mind that if an immediate dentin sealing technique was used, then it is absolutely recommended that dual cure cements or composites be avoided, as the tooth stump is protected with a resin after preparation, and there is a risk of union between the resin and the temporary cement. Temp Bond Clear once again removes easily, and this Bruxer anterior crown and veneer combination case is successfully seated.
In closing, considerations and decisions regarding provisional cements should be based upon your individual patient's dental history, the composition of the preparation, length of time the temporary will be worn, the final restoration desired, now this includes the final restorative cement choice, plus the retentive and aesthetic outcomes that are acceptable for a smooth workflow and a comfortable patient experience. As a dental assistant or a doctor who routinely seeks provisional restorations, whether BioTemps or chairside fabricated, thinking ahead and keeping strict situational awareness of each procedure will assist you in a more predictable outcome. Right back to you, Megan.
Thank you for that, Will. Well, that about wraps it up for this episode of Chairside Live. So on behalf of everyone here at Glidewell Laboratories, thank you for watching, and I'll meet you right back here next time.